Well, hey, everybody, this is Robert, and welcome to today's podcast. Now, Oropouche fever is piercing the sphere of mainstream media this year as thousands of cases of the vector borne disease have been reported in the Caribbean and in South America. So, joining me today for a Q&A on Oropouche fever is Karina Mondragon-Shem, PhD. Dr. Mondragon-Shem is a vector biologist who specializes in the ecoepidemiology and social impact of tropical diseases. Dr. Mondragon-Shem, welcome to the show, ma'am.
Thank you. Thank you for having me, Robert.
You bet. Well, let's go ahead and start with a brief summary, brief introduction of Oropouche virus, Oropouche fever, and a little bit on the history.
Sure. So, Oropouche, which you might also hear pronounced Oropouche, it's a virus that is found in many mammals like birds, monkeys, rodents, and sloths. It's an arbovirus, meaning that it's transmitted by the bite of an insect, very much like dengue, Zika, chikungunya. And in this case, it is midges or mosquitoes that transmit the virus. And so the midge would bite an infected animal, and then they would bite a human, and that's how we would get the disease. It's considered endemic to sort of the Amazon basin, and it has caused a couple of epidemics, about 30 epidemics in countries like Brazil, Peru, and Panama. And the virus was first discovered in 1955 from a febrile forest worker in Trinidad and Tobago. And therefore, the virus and the disease are named after the Oropouche River where it was discovered.
Okay, great. Now, you may agree that 2024 has been a pretty extraordinary year for the virus. And what have we seen so far as the numbers and the geographic distribution of Oropouche?
So there has been a lot of cases. It has been on the news a lot recently. There's an estimated around 8,000 cases of Oropouche fever or infections with Oropouche virus, mainly in Brazil, which has reported about 77,000 of those cases. But there's also been cases in Panama and Bolivia, Peru, Cuba, and Colombia. And in Brazil, which is the hardest hit country at the moment, just as an example, there were about 800 cases last year in 2023, and it has jumped to over 7,000 cases in 2024. So it is of great concern. In addition, there's been a few cases reported in Europe, but those are imported cases. I think the travelers had been to Cuba, and it's suspected that that's where they got the virus.
Yeah, and just another note, the follow up on that is the Florida Department of Health has reported 11 imported cases here in Florida too, and all from Cuba. Yeah.
Yeah.
What factors do you believe are behind this increased dissemination of Oropouche?
So there could be several factors, as with many other vector-borne diseases. Climate is huge influence. So the weather could be more conducive for the flies to breed and to distribute to new areas. Human mobility and animal mobility can also contribute that, because if the animals that carry the virus move to different places, then there's more hosts for the biting midge to feed from, and more humans to get the disease. Deforestation, land use changes, that's very common, and it also happens with malaria, for instance. However, more recently, because people are more aware of the virus, it's also possible that they are now specifically testing for this virus. So some of these cases will be due to an increased diagnostics at the laboratory level before, whereas before people weren't as aware of this virus and could confuse it with another infection.
Right. Who's most at risk for getting infected by this?
People traveling to areas where there have been reports of virus transmission, um, perhaps also those with pre-existing conditions, with a weakened immune system, elderly, young children, or pregnant women, people who spend a lot of time outdoors, and that are at increased risk of exposure to insect bites. So personal protection is very important.
Yeah. Let's talk a little bit more about the transmission and the vectors. First, can you tell us what a midge is? Because I don't think everybody knows that.
Yeah, so we always hear on the news associated to diseases, more mosquitoes, and things like that. So a biting midge is a very, very small insect. I would say it could be the size of a mosquito wing. So it gives you an idea of how small it can be.
Mhm.
Only the female takes blood because it needs it to develop the eggs. So this is very similar to mosquitoes. And they're often called no-see-ums.
Mhm.
Because they're so tiny, the bite is actually quite painful. There's about 70 species of them in the neotropics, and they can bite inside or outside houses, in urban, peri-urban environments, when people live close to like banana plantations or cacao plantations, which provide the soil rich in nutrients that the flies need to breed. People become at risk for this disease. And an interesting thing that I learned recently is that biting midges don't need a high viral load when they bite an infected animal. They don't need a high viral load to become infected themselves and then become infective to another animal or human. And so that makes them very good vectors for this virus in particular. Mosquitoes require a much higher load of the virus to become infected and then infect another animal.
Are there certain genera of mosquitoes that are most likely to transmit this?
It's been reported for the sylvatic cycle Aedes. There is not all Aedes. Aedes serratus has been reported. Coquilitidia venezuelensis has also been reported as a vector for the sylvatic cycle. For the urban cycles, you have Culex quinquefasciatus, but the main vector that people are paying attention now is definitely the Culicoides, or the biting midge.
Yeah. Um, now the symptoms and pathology pretty similar to other arboviruses.
Mhm.
Yeah. Can you describe a little bit about the symptoms?
So it's very similar to a dengue or a Zika or a chikungunya initially. So people will get fever, severe headache, chills like general malaise, joint pain, photophobia. So they'll be very sensitive to the light, dizziness, nausea, vomiting. It is in more severe cases that people might suffer from encephalitis, or some affection of the brain or the central nervous system. In some cases as well, a hemorrhagic condition can develop. Usually, most people will recover within the week. In some cases, people have what is known as a recidivance, I believe it's called, where they will get a repeat of symptoms even after the virus has left. And so you might get the symptoms of the virus, but then you're tested and the test can't detect the virus anymore. So this can often cause some confusion. And initially, the virus may have gone undiagnosed because people will just assume it's like a dengue or malaria, and then treat it as such, or it goes away on its own. And so the cases aren't reported. So there could be a lot of underreporting of cases.
Sure, sure. And one thing we've seen so far this year is something we had never seen before: our reported fatalities out of Brazil. And
Yes, there was two fatalities that have been reported. There were two young women in their 20s. They were very healthy otherwise. They did experience like a very rapid development of disease with the hemorrhagic symptoms, which then led to their deaths, unfortunately. And I think now health officials everywhere are just on the lookout for these conditions, just to try to understand why this is happening.
Yeah, and in recent weeks I think about eight reports of vertical transmission or mother to baby transmission possible. And they're not. I don't think they're confirmed yet, unless you know something different. What do we know about this today?
I think it's still being researched.
Yeah.
To date, Brazil is the only country that has reported this possible case of maternal to fetus transmission. There are a few that are suspected, and then again, they're still researching this.
Hmm.
There was one previous similar observation around the 1980s in Brazil, where there was suspected Oropouche infection in 9 pregnant women, and 2 of them miscarried. But again, they're still researching what the implications are. Is it actually related to this virus? Could something else be happening? And so there's a lot of research that needs to be done
Yeah.
now to understand what's going on.
Yeah, and it sure brings up flags of Zika from not too long ago,
Mm,
right? Yeah.
exactly. Yes. Yeah.
Um, can you get Oropouche more than once? What's the immunity situation with that?
Well, as far as I know, there's around 4 genotypes or variants of the Oropouche virus that have been identified. And from what we know, infection with any of these genotypes should generate antibodies or protection against future infection. But again, the virus can change. And so this will also have to be a target of research.
Yeah. Um, so what are health officials doing in, say, Brazil or other areas of Latin America, um, to battle this spread? What can be done?
So, yeah. So the main thing is surveillance if of cases and of vectors all over Latin America. I would say improving laboratory diagnostics, looking into mosquito and biting midge control methods, if possible, and helping the public be aware of what's going on and how they can protect themselves. And also the Pan American Health Organization, or PAHO, is trying to create guidance and lead the countries through this problem, how to best address it, creating sort of the key steps that health authorities in each countries should take in order to prevent the future outbreaks or the spread of this disease, and paying a special attention to the cases of possible cases of vertical transmission or any other effect on pregnant women.
Yeah, and as far as just individuals,
Mhm.
the same preventive measures you would use with any other mosquito-borne disease, I take it? DEET.
Yes and no. Because the midge is so tiny, the normal bed nets that you would use for malaria, for example, will not work. The insect will just go right through it. So you need a finer mesh bed net, which may become too hot to sleep under. So people might have a bit of trouble using it, but it should be a finer mosquito net, or finer mesh mosquito net around where people rest. You can put this kind of mesh on windows and doors, entrances to the homes, wearing clothing that will cover your arms and legs as much as possible, applying repellents containing DEET or other active ingredients, and remembering to reapply. You might often be sweating or carrying on about your day, and you will lose that protection from the repellent. So remembering to reapply often. And so, yes, just as much as personal protection as you can, and being aware of where you're going and making sure to communicate to your doctor if you notice symptoms, and tell them where you've been traveling.
Yeah, Good advice. Any final thoughts, Dr. Mondragon-Shem?
No, I think there's still that we don't know. So there are already a few funding calls that have come out for researchers to really look at the details of why this is happening now. What is the difference of the virus in different countries? Why is it behaving differently in Brazil, for instance? And there's a lot still to find out. And so hopefully in the coming months, we'll be able to know a bit more.
Yeah. And if the audience would like to read Dr. Mondragon-Shem's recent post on the blog Bug Bitten, I'll link to it in the show notes. And I want to thank you, Dr. Karina Mondragon-Shem, for sharing your time and expertise with us today. Thank you, ma'am.
Thank you, Robert.